Hi, this is Eve with True Crime and Coke. You are about to listen to an EDUsode. These are shorter episodes dedicated to educational information ranging from forensic terminology, crime facts, body processes, to interesting FBI files. But if you want to hear about true crime, disappearances, conspiracies, hauntings, and anything strange or unusual, then go to a regular episode. Disclaimer, I am not associated in any way to the criminal or medical field. In other words, I may not even know what I'm talking about. Now that that's out of the way, let's begin. Hi, this is Eve. Welcome to EDUsode 4, which is part 2 of EDUsode 3. I'll have to figure out a better way to number these EDUsodes. So anyway, this one will be about autopsy stuff. Some of it you'll hear again from the other show with the decomposition and stuff. And sorry, I'm playing tug with my dogs as I'm trying to record this right now. Okay, so after that, I will read some interesting stories like from coroners and from morgue workers and stuff. So let's get started. An autopsy, also known as post-mortem examination, abduction, necropsy, or autopsia cadaverum, is a surgical procedure that consists of a thorough examination of a corpse by dissection to determine the cause, mode, and manner of death, or to evaluate any disease or injury that may be present for research or educational purposes. The term necropsy is generally reserved for animals. Autopsies are usually performed by a specialized medical doctor called a pathologist. In most cases, a medical examiner or coroner can determine cause of death, and only a small portion of deaths require an autopsy. Autopsies are performed for either legal or medical purposes. Autopsies can be performed when any of the following information is desired: to determine if death was natural or unnatural, injury source and extent on the corpse, manner of death must be determined, time since death, establish identity of the deceased, retain relevant organs. If it is an infant, determine live birth and viability. For example, a forensic autopsy is carried out when the cause of death may be a criminal matter, while a clinical or academic autopsy is performed to find the medical cause of a death and is used in cases of unknown or uncertain death or for research purposes. Autopsies can be further classified into cases where external examination suffices and those where the body is dissected and internal examination is conducted. Permission from next of kin may be required for internal autopsy in some cases. Once an internal autopsy is complete, the body is reconstituted by sewing it back together. The term autopsy derives from the ancient Greek autopsia, which means to see for oneself, and derived from autos, which means oneself, and opsis, which means sight or view. The word autopsy has been used since around the 17th century. It refers to the examination of the inside of the dead human body to discover diseases and cause of death. The term post-mortem derives from the Latin for post, meaning after, and mortem, meaning death. It was first recorded from 1850. The principal aims of an autopsy is to determine cause of death, mode of death, manner of death, and state of health of the person before he or she died, and whether any medical diagnosis and treatment before death was appropriate. In most Western countries, the number of autopsies performed in hospitals has been decreasing every year since 1955. Critics, including pathologist and former editor George Lundberg, have charged that the reduction in autopsies is negatively affecting the care delivered in hospitals because when mistakes result in death, they are often not investigated and lessons therefore remain unlearned. When a person has given permission in advance of their death, autopsies may also be carried out for the purposes of teaching or medical research. An autopsy is frequently performed in cases of sudden death where a doctor is not able to write a death certificate or when death is believed to result from an unnatural cause. These examinations are performed under a legal authority by the medical examiner, a coroner, or a procurator fiscal, and do not require the consent of relatives of the deceased. The most extreme example is the examination of murder victims, especially when medical examiners are looking for signs of death or the murder method, such as bullet wounds and exit points, signs of strangulation, or traces of poison. Some religions, including Judaism and Islam, usually discourage the performing of autopsies on their adherents. Autopsies are used in clinical medicine to identify medical error or a previously unnoticed condition that may endanger the living, such as infectious diseases or exposure to hazardous materials. A study that focused on myocardial infarction or a heart attack as a cause of death found significant errors of omission and commission, or a sizable number of cases ascribed to myocardial infarctions but were not myocardial infarctions, and a significant number of non-myocardial infarctions were actually myocardial infarctions. A systemic review of studies of autopsy calculated that in about 25% of autopsies, a major diagnostic error will be revealed. However, this rate has decreased over time, and the study projects that in a contemporary U.S. institution, 8.4 to 24.4% of autopsies will detect major diagnostic errors. A large meta-analysis suggested that approximately 1/3 of death certificates are incorrect and that half of the autopsies performed produced findings that were not suspected before the person died. Also, it is thought that over 1/5 of an unexpected findings can only be diagnosed histologically, which means by biopsy or autopsy, and that approximately 1/4 of unexpected findings, or 5% of all findings, are major and can similarly only be diagnosed from tissue. One study found that out of 694 diagnoses, autopsies revealed 171 misdiagnoses, including 21 cancers, 12 strokes, 11 heart attacks, 10 pulmonary emboli, and 9 endocarditis, among others. Focusing on intubated patients, one study found abdominal pathological conditions, abscesses, bowel perforations, or infarction were as frequent as pulmonary emboli as a cause of Class 1 errors, while patients with abdominal pathologic conditions generally complained of abdominal pain. Results of examination of the abdomen were considered unremarkable in most patients, and the symptom was not pursued. There are 4 main types of autopsy: medico-legal or forensic or coroner's autopsies to seek the cause and manner of death and to identify the decedent. They are generally performed as prescribed by applicable law in cases of violent, suspicious, or sudden deaths, deaths without medical assistance, or during surgical procedures. Clinical or pathological autopsies are performed to diagnose a particular disease or for research purposes. Virtual or medical imaging autopsies are performed using MRI and CT only. A forensic autopsy is used to determine the cause, mode, and manner of death. Forensic science involves the application of the sciences to answer questions of interest to the legal system. Medical examiners attempt to determine the time of death, the exact cause of death, and what, if anything, preceded the death, such as a struggle. A forensic autopsy may include obtaining biological specimens from the deceased for toxicological testing, including stomach contents. Toxicology tests may reveal the presence of one or more chemical poisons. All chemicals in sufficient quantities can be classified as poison, by the way. So, anyway, it reveals the presence of one or more chemical poisons, and their quantity. Because postmortem deterioration of the body, together with the gravitational pulling of bodily fluids, will alter the bodily environment, so toxicology tests may overestimate rather than underestimate the quantity of the suspected chemical. Following an in-depth examination of all the evidence, a medical examiner or coroner will assign a manner of death from the choices prescribed by the fact finder's jurisdiction and will detail the evidence on the mechanism of death. Clinical autopsies serve two major purposes. They are performed to gain more insight into pathological processes and determine what factors contributed to a patient's death. For example, material for infectious disease testing can be collected during an autopsy. Autopsies are also performed to ensure the standard of care at hospitals. Autopsies can yield insight into how patient deaths can be prevented in the future. Within the United Kingdom, clinical autopsies can be carried out only with the consent of the family of the deceased person, as opposed to a medico-legal autopsy instructed by a coroner, which is England and Wales, or a procurator fiscal, which is in Scotland, to which the family cannot object. The body is received at a medical examiner's office, municipal mortuary, or hospital in a body bag or evidence sheet. A new body bag is used for each body to ensure that only evidence from that body is contained within the bag. Evidence sheets are an alternative way to transport the body. An evidence sheet is a sterile sheet that covers the body when it is moved. If it is believed there may be any significant evidence on the hands, for example, like gunshot residue or skin under the fingernails, a separate paper sack is put on each hand and taped shut around the wrist. There are two parts to the physical examination of the body: the external and internal examination. Toxicology, biochemical tests, or genetic testing or molecular autopsy often supplement these and frequently assist the pathologist in assigning the cause of death. At many institutions, the person responsible for handling cleaning and moving of the body is called a Diener, the German word for servant. In the UK, this role is performed by an anatomical pathology technician who will also assist the pathologist in eviscerating the body and reconstruction after the autopsy. After the body is received, it is first photographed. The examiner then notes the kind of clothes and their position on the body before they are removed. Next, any evidence such as residue, flakes of paint, or other material is collected from the external surfaces of the body. Ultraviolet light may also be used to search body surfaces for any evidence not easily visible to the naked eye. Samples of hair, nails, and the like are taken, and the body may also be radiographically imaged. Once the external evidence is collected, the body is removed from the bag, undressed, and any wounds that are present are examined. The body is then cleaned, weighed, and measured in preparation for the internal examination. A general description of the bodies as regards to ethnic group, sex, age, hair color, and length, eye color, and other distinguishing features such as birthmarks, old scar tissue, moles, tattoos, etc., is then made. A voice recorder or a standard examination form is normally used to record this information. In some countries, such as Scotland, France, Germany, and Canada, an autopsy may comprise an external examination only. This concept is sometimes termed a view and grant. The principle behind this is that the medical records, history of the deceased, and circumstances of death have all indicated as to the cause and manner of death without the need for an internal examination. If not already in place, a plastic or rubber brick called a head block is placed under the shoulders of the deceased, hyperflexing the neck, making the spine arch backward while stretching and pushing the chest upward to make it easier to incise. This gives the APT, or the anatomical pathology technician, and pathologist maximum exposure to the trunk. After this is done, the internal examination begins. The internal examination consists of inspecting the internal organs of the body by dissection for evidence of trauma or other indications of the cause of death. For the internal examination, there are a number of different approaches available, and they are a large and deep Y-shaped incision, which can be made starting at the top of each shoulder and running down the front of the chest, meeting at the lower point of the sternum or breastbone. A curved incision made from the tips of each shoulder in a semicircular line across the chest or décolletage to approximately the level of the second rib, curving back up to the opposite shoulder. Or a single vertical incision is made from the sternal notch at the base of the neck, and a U-shaped incision can be made at the tip of both shoulders, down along the side of the chest to the bottom of the rib cage, following along it. This is typically used on women and during chest-only autopsies. There is no need for any incision to be made, which will be visible after completion of the examination when the deceased is dressed in a shroud. In all of the above cases, the incision then extends all the way down to the pubic bone, and avoiding, where possible, transecting any scars that may be present. Bleeding from the cuts is minimal or non-existent because the pull of gravity is producing the only blood pressure at this point, related directly to the complete lack of cardiac functionality. However, in certain cases, there is anecdotal evidence that bleeding can be quite profuse, especially in cases of drowning. At this point, shears are used to open the chest cavity. The prosecutor uses the tool to cut through the ribs on the costal cartilage to allow the sternum to be removed. This is done so that the heart and lungs can be seen in situ, and that the heart, in particular the pericardial sac, is not damaged or disturbed from opening. A PM40 knife is used to remove the sternum from the soft tissue that attaches it to the mediastinum. Now the lungs and the heart are exposed. The sternum is set aside and will be eventually replaced at the end of the autopsy. At this stage, the organs are exposed. Usually the organs are removed in a systemic fashion. Making a decision as to what order the organs are to be removed will depend highly on the case in question. Organs can be removed in several ways. The first is the en masse technique of le Toulet, whereby all the organs are removed as one large mass. The second is the en bloc method of Ghon. The most popular in the UK is a modified version of this method, which is divided into 4 groups of organs. Although these are the 2 predominant evisceration techniques, in the UK, variations on these are widespread. One method is described here. The pericardial sac is opened to view the heart. Blood for chemical analysis may be removed from the inferior vena cava or the pulmonary veins. Before removing the heart, the pulmonary artery is opened in order to search for a blood clot. The heart can then be removed by cutting the inferior vena cava, the pulmonary veins, the aorta and the pulmonary artery, and the superior vena cava. This method leaves the aortic arch intact, which will make things easier for the embalmer. The left lung is then easily accessible and can be removed by cutting the bronchus artery and vein at the hilum or hilum. The right lung can then be similarly removed. The abdominal organs can be removed one by one after first examining their relationships and vessels. Most pathologists, however, prefer the organs to be removed all in one block, using dissection of the fascia, blunt dissection, using the fingers or hands, and traction. The organs are dissected out in one piece for further inspection and sampling. During autopsies of infants, this method is used almost all the time. The various organs are examined, weighed, and the tissue samples in the form of slices are taken. Even major blood vessels are cut open and inspected at this stage. Next, the stomach and intestinal contents are examined and weighed. This could be useful to find the cause and time of death, due to the natural passage of food through the bowel during digestion. The more area empty, the longer the deceased had gone without a meal before death. The body block that was used earlier to elevate the chest cavity is now used to elevate the head. To examine the brain, an incision is made from behind one ear over the crown of the head to a point behind the other ear. When the autopsy is completed, the incision can be neatly sewn up and is not noticed when the head is resting on a pillow in an open casket funeral. The scalp is pulled away from the skull in two flaps, with the front flap going over the face and the rear flap over the back of the neck. The skull is then cut with a circular or semicircular bladed reciprocating saw to create a cap that can be pulled off, exposing the brain. The brain is then observed in situ. Then the brain's connection to the cranial nerves and spinal cords are severed, and the brain is lifted out of the skull for further examination. If the brain needs to be preserved before being inspected, it is contained in a large container of formalin for at least 2, but preferably 4 weeks. This not only preserves the brain, but also makes it firmer, allowing easier handling without corrupting the tissue. An important component of the autopsy is the reconstitution of the body such that it can be viewed, if desired, by relatives of the deceased following the procedure. After the examination, the body has an open and empty thoracic cavity with chest flaps open on both sides. The top of the skull is missing, and the skull flaps are pulled over the face and neck. It is unusual to examine the face, arms, hands, or legs internally. In the UK, following the Human Tissue Act in 2004, all organs and tissue must be returned to the body unless permission is given by the family to retain any tissue for further investigation. Normally, the internal body cavity is lined with cotton, wool, or a similar material, and the organs are then placed into a plastic bag to prevent leakage and are returned to the body cavity. The chest flaps are then closed and sewn back together, and the skull cap is sewed back into place. Then the body may be wrapped in a shroud, and it is common for relatives to not be able to tell the procedure has been done when the body is viewed in a funeral parlor after embalming. Post-mortem examination or necropsy is far more common in veterinary medicine than in human medicine. For many species that exhibit few external symptoms or that are not suited to detailed clinical examination, it is a common method used by veterinary physicians to come to a diagnosis. A necropsy is mostly used like an autopsy to determine the cause of death. The entire body is examined at the gross visual level, and samples are collected for additional analysis. Forensic pathology is the process of determining the cause of death by examining the dead body during an autopsy. An autopsy generally takes place in the pathology department of a hospital. In the case of a suspicious death or a confirmed homicide, police investigators will be present at an autopsy to gather information, take photographs, and seize exhibits of non-medical nature, such as clothing, bullet fragments, and items that might identify the body. These items would include personal documents, fingerprints, and DNA samples. During an autopsy, a forensic pathologist dissects the body carefully, examining, documenting, and analyzing the body parts to determine the cause of death. In the first stage of an autopsy, the pathologist examines the body for external injuries and indicators of trauma that may provide a cause of death. In this first stage of examination, the pathologist will make an estimate of the time of death by observing evidence of 4 common post-mortem indicators. These are body temperature, the degree of rigor mortis, post-mortem lividity, and progress of decomposition. So this will get kind of into some more of the detail of the rigor mortises that I told you about in the previous EDUsode. So rigor mortis is the scientific name given to the loss of body temperature after death, which can sometimes be used to estimate the time of death. This is a viable technique in cases where the body is being examined within 24 hours following death. This method of estimating time of death can vary significantly dependent upon many possible variables, such as ambient room temperature being within a normal range of approximately 22 degrees Celsius, pre-death body temperature of the victim not being elevated by illness or exertion. Thickness of clothing that might insulate the body temperature escape, and the temperature and conductivity of the surface the body was located on that could artificially increase or decrease temperature loss. Considering a normal body temperature of 37 degrees Celsius at the time of death, it can be estimated that the body will cool at a rate of 1 to 1.5 degrees Celsius per hour. This calculation is known as the Gleister equation. So taking an internal rectal temperature and subtracting that from 37 degrees Celsius will provide an estimate of the number of hours that have passed since the time of death. For example, a dead body with a measured temperature of 34 degrees Celsius would provide a time range of 3 to 4.5 hours since the time of death. Rigor mortis is a term used to describe the stiffening of the body muscles after death. A dead body will go from a flaccid or limp muscle condition to one where all the muscles become contracted and stiff, causing the entire body to become constricted into a fixed position. After being in a constricted and fixed position, the muscles eventually become flaccid again. In normal room temperatures, this stiffening of muscles and the relaxing again has a predictable time progression of approximately 36 hours. In this progression, the stiffening of muscles will take approximately 12 hours. The body will remain stiff for 12 hours and will progressively become flaccid again over the next 12 hours. Stiffening of muscles begins with the small muscles of the hands and face during the first 2 to 6 hours, and then progresses into the larger muscle groups of the torso, arms, and legs over the next 6 to 12 hours. These are the general rules. However, the rate of rigor mortis can be different for infants, persons with extreme muscle development, or where extensive muscle activity precedes death, such as a violent struggle. In determining the time of death in average environmental temperatures, it is recommended that if the body feels warm and is flaccid, it has been dead for less than 3 hours. If the body feels warm and is stiff, it has been dead for 3 to 8 hours. If the body feels cold and stiff, it has been dead for 8 to 36 hours. If the body feels cold and flaccid, it has been dead more than 36 hours. Postmortem lividity refers to a discoloration or staining of the skin of a dead body as the blood cells settle to the lowest part of the body due to gravity. This discoloration will occur across the entire lower side of a body. However, in places where parts of the body are in contact with the floor or another solid object, the flesh compresses and staining will not occur in that area. The staining is a reddish-purple coloring, and it starts to become visible within 1 hour of death and becomes more pronounced within 4 hours. Within the first 4 hours, lividity stains are not fixed, and if the body is moved, the blood products will shift and stain the part of the body that has become lower. In most cases, these stains become fixed between 12 and 24 hours. As such, they can be viewed as an indicator of how the body was left at the time of the death. Importantly, if a body is found with postmortem lividity stains not at the lowest point in the body, it can be concluded that the body has been moved or repositioned after the 12 to 24 hour stain setting period. Decomposition is the final indicator pathologists can look at to estimate the time of death. Sometimes dead bodies are not discovered in time to use body temperature, rigor mortis, or early lividity indicators to estimate a more exact time of death. In these cases, assessing the progress of decomposition becomes important. Decomposition starts as soon as the body ceases to be alive. Subject to environmental conditions of extreme heat or cold, the readable signs of decomposition will become apparent 36 to 48 hours after death. These signs include bloating of the body and a marbling discoloration of the skin in a spiderweb pattern along surface blood vessels. As the body continues to decay, the skin surface will open and body fluids will begin to seep out. In advanced stages of decomposition, the body is often no longer identifiable by facial recognition, and DNA testing or dental records become the tools to determine identity. At very advanced stages of decomposition, flies and maggots begin to emerge, and the number of life cycles of the maggots to fly can be estimated by a forensic entomologist to provide the amount of time that has passed since these insect life cycles began. Once these preliminary examinations have been made, the pathologist will cut the corpse open to conduct a detailed internal examination of each organ to look for signs of trauma, disease, or external indicators that might explain the cause of death, such as water in the lungs or toxins in blood. Okay, so that pretty much sums up basic autopsies, and we'll get into more detail on stuff like a drowning victim, murder, we'll get into more of that in the future. But I was going to read some articles, 12 of the creepiest things coroners and others have experienced on the job, tales from the morgue, and stuff like that. So I'm just going to read them, and of course they will be in my sources. So, that said, there are cases that are extremely gross and weird, even for those who have been in the business for a long time. On Reddit, these 12 professionals shared their all-time weirdest moments. So, here we go. 1. My very first case was an elderly male who died in a house fire. The firemen were unable to extract him until the fire was put out, so he was completely cooked. What struck me was how similar the smell is to a pig roast. When I opened the rib cage, it looked just like cooked ribs without sauce. The skin was crackling and oil and juices pulled off the crease between the skin and an exposed rib cage. I was off port for about 3 months. Number 2. My sister works as a histologist and was helped out for 1 or 2 autopsies. She told me a story of how when they were doing an autopsy on this guy, his bowels were extremely swollen, hard, and stuck together. On further examination, he had swallowed a fish bone which pierced his stomach into his intestines and skewered them together, leading to his death. Ouch. Number 3. One of my first cases was a young male gunshot victim. He had Pizza Hut the evening he was killed. When we rolled him over to trace the bullet paths, the pressure forced the gas from his bowel. Nothing stinks quite like a dead man's pizza farts. Number 4. Spent 2 weeks shadowing a forensic examiner and a toxicologist in the medical examiner's office. One thing that they did not warn me about is that dead bodies will make noise when rolled over and remaining air is expelled from their lungs. So, cut to me observing my first autopsy on a mid-50s male who committed suicide by blowing his face off with a shotgun. The medical examiner and tech were rolling him over onto the table from the gurney when he let out a loud zombie-like "oh" as the air went out from his lungs. Seeing me jump and recoil back, the examiner laughed and told the body, "Shut up, I haven't done anything to you yet." Number 5. I'm a mortician. Upon preparing a body during the cleansing stage of the embalming process, I found the person possessed a Pierce Albert piercing. Whatever, right? Well, it was pretty weird to see an octogenarian Baptist minister with a ring in his bird. Number 6. Friend had a relative or friend of a parent that was a coroner or worked in forensics. One day, a body was pulled from a river, so the skin had shriveled, but they wanted to get fingerprints. So the forensics woman cut the skin on a finger so that she can slide her own finger in under the skin and smooth it out from the inside. I always thought that was super creepy. Number 7, suicide by pills and alcohol. That in itself isn't that shocking. The individual took an entire bottle of sleeping pills, drank a half of a bottle of alcohol, and got into their hot tub. The individual died, but the body remained in the hot tub until the smell of the decomp alerted neighbors. If you could imagine a body decomposing, then liquefying in a hot tub, it still really doesn't do the actual side of it justice. The smell was so intense that many of us vomited, including the guys from Aftermath Heat, hired by the family to clean up. Best I can describe it is, the individual died in a hot tub, which then became a giant crock pot of dead body stew. Number 8. So I used to do some work for a forensic anthropologist at the MEO in our city. We had a set of remains that were 1, found in a chimney, 2, with a crack pipe, and 3, a burlap sack. We called him Crack Santa. So I'm sorry about all the noise. I am outside recording, and we're supposed to have some really severe storms tonight. So the wind is really picking up. So I'll try to hurry and finish it because it's loud, and the birds, I swear, have been on crack. They've been crazy today, so apologize about all this noise. Number 9. My maternal grandfather was a crime scene photographer during his time. Note, this was in Bombay, India. One of the cases he had spoken to my dad about was this one about a serial killer who used to go about the streets of Bombay, and whenever he used to come across the homeless people, he used to take really huge stones and smash the heads of these people while they used to sleep at night. He used to be called to take the photos of those victims. My grandfather eventually died an alcoholic. My dad says having to see such horrible crimes and to have to immortalize them in these photos and develop them eventually led to him drinking. Apparently, my mom and her sisters used to find him passed out on the streets and had to hide the bottles from him. He was never abusive or anything toward them. I just guess his profession may have drove him to it. Number 10. I worked with the city coroner for a while. I was a general assistant running files, etc. He had a copy of an autopsy that he did of a serial killer with pictures bound into a coffee table type book. Whenever you were friendly and new, he would always offer it to people to look at. Now that would be really cool. Number 11. Pathologist here. A couple of months ago, we had a cadaver of a pretty skinny dead guy at my hospital. Nothing weird, right? Wrong. This dude had an enormous penis. I don't mean just large. It was literally so big that it was flopping well past the midpoint of his femur. We reacted as it behooves a couple of grown-ass, highly educated, and serious men by laughing our asses off and calling our colleagues to come check this out. Do you hear that bird? That is the loudest bird I have ever heard in my entire life. Number 12. My mother is a pediatrician and had a very amusing story from her med school days. So back then, she and her co-students lived together in a house with a house mother. Not quite a dorm or sorority, but similar. One day, they had to spend the whole day dissecting cadavers, especially the chest area. Everyone is quite hungry by dinner time. Well, in comes the house mother with a huge plate of ribs. The whole group just noped the heck out of there. Okay, so that bird is getting really super annoying, and I'm sure it hurts your ears. And the 12 creepiest things I just read to you is really mild and boring. So I think I'm going to stop there, and I will do another EDUsode of this continued and actually find some interesting things I can read. So this will be next week, and I will have a regular episode out before then. So have a good evening.